Hello and welcome. Today we're diving deep into neuromyelitis optica, also known as NMO or Devick's disease. This rare autoimmune disorder primarily affects the optic nerves and spinal cord, leading to potentially devastating consequences. Join us as we unravel the complexities of MO, exploring its causes, symptoms, diagnosis, and the latest advancements in treatment. The exact cause of MO remains a subject of ongoing research, but we know it's an autoimmune condition. This means the body's immune system mistakenly attacks its own healthy cells. In MO, the primary target is a protein called aquaporin 4, which is abundant in the cells of the central nervous system, particularly in the optic nerves, spinal cord, and brain. What triggers this autoimmune attack is still unclear, but genetic predisposition and environmental factors are suspected to play a role. Some studies suggest a possible link between certain infections and the onset of MMO, but more research is needed to confirm these associations. Let's break down what happens at a cellular level. Aquaporin 4 forms water channels in the membranes of astrocytes, a type of supporting cell in the brain and spinal cord. When the immune system targets aquaporin 4, antibodies, specifically MOIG or anti-aquaporin 4 antibodies, bind to these water channels. This triggers a cascade of inflammation, complement activation, and ultimately damage to the astrocytes and surrounding myelin sheath, the protective covering around nerve fibers. This demyelination and axonal damage disrupts the communication between the brain and the rest of the body, leading to the characteristic symptoms of MO. Neuromyelitis optica is a rare disease. Estimates suggest that affects between 0.5 to 10 people per 100,000 worldwide. It's more common in women than in men, with a female-to-male ratio of around 9:1. While MO can occur at any age, it's most frequently diagnosed in adults in their 30s and 40s. Geographically, MO appears to be more prevalent in certain populations, including those of Asian, African, and Native American descent. However, it's important to remember that MO can affect anyone, regardless of their ethnicity or geographic location. The signs and symptoms of MMO can vary widely from person to person, but the most common include optic neuritis and transverse myelitis. Optic neuritis involves inflammation of the optic nerve, leading to eye pain, blurred vision, and even vision loss in one or both eyes. Transverse myelitis is inflammation of the spinal cord, causing weakness, numbness, tingling, and bowel and bladder dysfunction. These symptoms can develop suddenly, often over days or weeks, and may occur separately or together. Some individuals may also experience other neurological symptoms, such as brainstem involvement, leading to nausea, vomiting, hiccups, or respiratory difficulties. Diagnosing MO can be challenging, as its symptoms can overlap with other neurological conditions, such as multiple sclerosis, MS. A thorough neurological examination, along with magnetic resonance imaging (MRI) of the brain and spinal cord, is crucial. MRI scans can help identify characteristic lesions in the optic nerves and spinal cord. However, the definitive diagnosis of MO often relies on blood tests to detect the presence of anti-aquaporin 4 antibodies. These antibodies are highly specific for MMO and are present in the majority of patients. Further diagnostic tests, such as visual evoked potentials, AVPs, and spinal fluid analysis, may also be performed to support the diagnosis. While the primary form of MO involves antibodies to aquaporin 4, there's also a subtype where these antibodies are absent. In these cases, antibodies to myelin oligodendrocyte glycoprotein or MOG antibodies may be found. MOG, antibody-associated disease, or MOGID, shares some similarities with MMO, but often presents with distinct clinical and imaging features. Differentiating between aquaporin 4 and MOGID and other inflammatory demyelinating diseases is crucial for appropriate treatment and management. Currently, there is no cure for neuromyelitis optica, but there are effective treatments available to manage the symptoms, prevent relapses, and improve the quality of life. Acute attacks are typically treated with high-dose corticosteroids, such as intravenous methylprednisolone, to reduce inflammation. Plasma exchange, also known as plasmapheresis, may be used in severe cases to remove harmful antibodies from the blood. Long-term management involves immunosuppressant medications, such as azathioprine, mycophenolate mofetil, rituximab, and more recently, monoclonal antibodies like eculizumab, inebilizumab, and satralizumab. These medications help to suppress the immune system and prevent further attacks. Physical therapy, occupational therapy, and other rehabilitation services can also play an important role in helping patients regain function and cope with the physical challenges of NMO. As an autoimmune disease, there are no proven methods to definitively prevent MO. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management, may help to support the immune system. Avoiding known triggers, such as infections, may also be beneficial. Early diagnosis and treatment are crucial to minimize the risk of long-term disability. It's important for individuals with NMO to work closely with their healthcare providers to develop a personalized management plan. The prognosis for people with MMO can vary depending on the severity and frequency of attacks, as well as the promptness of diagnosis and treatment. Some individuals may experience relatively mild symptoms with infrequent relapses, while others may face more severe disability due to frequent and severe attacks. Early and aggressive treatment with immunosuppressants can significantly improve the long-term outcome. Ongoing research is focused on developing new and more effective therapies for MO. Studies are exploring the potential of targeted therapies that specifically block the action of aquaporin-4 antibodies or modulate the immune system. Clinical trials are also investigating new medications and treatment strategies. The future holds promise for improved outcomes and a better quality of life for individuals living with neuromyelitis optica.